Good evening, everybody, and welcome to our Womb Care Clinic webinar. As we come almost the close of the year and as we jump into the festive season, as Womb Care Clinic, we figured that it's important for us to continue learning and strengthening ourselves by talking about certain topics, certain diseases that affect um, both men and women. And this time around, we'll be talking about syphilis. My name is Dr. Paul Mwemba Msoba. I'm a consultant obstetrician and gynecologist. I am also a fistula surgeon and a fertility fellow that is based at Womb Care Clinic. Please note that this session is for learning and awareness purposes only. And for personal medical care, please consult your healthcare provider. So this is my presentation layout. So allow me to talk about syphilis. What is syphilis? I'm sure it's something that we've all heard of. And syphilis is simply preventable. And I think we need to start with that very important part, and highly curable sexually transmitted bacterial infection. It can also be transmitted, though on very rare occasion, through blood transfusion. And most importantly, there is what we call vertical transmission when it comes to syphilis. And this just means that the bacteria can be passed on from the mother to the baby, either within the womb itself or at the time of delivery. So it is highly preventable, highly curable, and it is a bacterial infection, which is primarily transferred through sexual intercourse, but also through vertical transmission. So a few facts about syphilis. Number one, most of the infections that are associated with syphilis are asymptomatic or unrecognizable, which simply means a person that has been infected with the bacteria that causes syphilis will not present with any clinical features. Number two, according to the World Health Organization, that's of 2022, about 8 million adults of reproductive age, which is between the ages of 15 to 49, acquired new infections of syphilis. 700,000 cases of congenital syphilis, which is a baby being born with syphilis. And this only happens if the mother has syphilis, goes untreated, and therefore it is transferred to the baby. Out of these, 150,000 resulted in early neonatal death or early death of a baby. And out of these 700,000 cases, we found that 115,000 had clinical presentation in which the baby had shown features of having suffered from syphilis. Poorly managed, syphilis in pregnancy results in 50 to 80% of cases with poor outcomes in terms of birth itself, which can be cases of early deaths from the baby or even just clinical symptoms that the baby may show. You find that special populations such as gay men or men who have sex with other men find that there are a bit higher numbers of syphilis in these particular populations. If you look at the risk factors, or if you look at sort of this global picture of congenital syphilis, and that's babies being born with syphilis, you find that the bulk majority of the cases are found within Africa. So Africa forms about 61% of the bulk of cases when it comes to syphilis, whilst Europe has got the smallest contribution that's there. So Zambia being an African country, what we find is that we've got very high levels of syphilis, with some studies showing a prevalence of about 3 to 8% in terms of syphilis itself. So what are the risk factors, or what puts somebody at risk of developing syphilis? Number one, having multiple sexual partners. So multiple sexual partners puts an individual at risk of obtaining syphilis. You find that substance abuse, and when we're talking about substance, we're talking about alcohol, we're talking about drugs, and these are some of the things that lowers someone's inhibitions. And once your inhibitions are lowered, you find that you're more prone to make reckless decisions. Having unprotected sexual intercourse is one of the risk factors that is there. And of course, there are the special populations, such as men who have sex with men and sex workers, that are at very high risk of developing syphilis. The use of social media has been shown to put people at risk. Why? Because it is through social media that some people get to meet their partners, and they might meet people that are already infected, and it increases the risk. Pregnant women that go through their pregnancy untested are at a very high risk of developing syphilis. So it is important that every pregnant person, once they discover that they're pregnant, within the first 3 months of their pregnancy, they are tested for syphilis, and if they are found to be positive, treatment is initiated. So, how is syphilis transmitted? Remember, this is a bacteria infection. That is something that is very important. And because it's a bacteria infection, you find that its spread in particular is through sexual intercourse. And this sexual intercourse can be of various forms. So there is also transmission that can happen during pregnancy. That is something that is important to note. And this transmission can happen through the placenta to the baby, and as well, it can happen at the time of delivery. What are the symptoms? Unfortunately, if I can put it that way, most cases of syphilis are asymptomatic, meaning somebody can have the particular infection with syphilis, and they do not know that they actually have the syphilis in their system. So this makes individuals that have got primary syphilis and secondary syphilis at very high risk of spreading it to other individuals. However, if one does develop symptoms, more especially with primary syphilis, what happens with such individuals that the most common presentation is something that we call a chancre or a sore that can appear on different areas where there's been exposure to the bacteria that causes syphilis. So this can be on the lips, this can be in the genital area, or even in the anal region. And this particular sore usually happens between 10 and 12 weeks after somebody has been infected. And the goodness or the badness, depending on how you get to look at it, is that this particular sore can actually heal on its own without any treatment. I say a bad thing, why? Because for some people, they might not even notice they developed this particular sore, and their immune system gets to take care of it. However, even though it's been cleared by your body's immune system, you still remain highly infectious to other people. Then there's secondary syphilis in particular. And with secondary syphilis, what begins to happen is that you start seeing symptoms 6 weeks to about 6 months after the initial presentation of the sore or the chancre. And what you have is a non-itchy rash that usually affects areas that are quite moist. So you find that for some individuals, this presentation is in the palms of their hands or the soles of their feet. It can also affect the genital area for women, and it is this sort of brownish, pinkish rash that affects the whole body. During this secondary stage of syphilis, individuals are also extremely infectious. So, meaning if they have contact, which can be of a sexual nature, with another person that does not have syphilis, you find that the chances of infection are very high. So I always say that with syphilis, it goes through sort of this grade or school graduation where you've got your primary, you've got your secondary, then you've got your latent phase. And in the latent phase, I always describe it as that period after finishing school before you go to university. With latent syphilis, there are no symptoms that an individual can exhibit. And in this latent period, you find that it occurs a year after an initial infection actually happened. And then from there, you go to tertiary syphilis. So with tertiary syphilis, this is the syphilis that went to higher education, went to the university. And this particular syphilis can last within your system for about 20 years. Depending on how strong your immune system, you find that the tertiary symptoms that come about with syphilis can come a bit earlier. However, when it comes to tertiary syphilis, this is the syphilis that attacks almost every organ in your body. So there are cases where somebody can start having meningitis or infection of the brain or the spinal cord area due to syphilis. You find that it can affect your heart and cause you to have a heart disease. It can affect your blood vessels. It can affect almost every organ in your body. It can affect your bones. It can affect your joints. So at this level, the bacteria has stayed in your system for a very long time. And as it's staying within your system, you find that it starts to target these vital organs of yours. And depending on which area has been affected, you begin to present with those particular symptoms. For patients that have an infection that goes to the brain, you find that there are episodes of unnecessary talking that they have or irrelevant talk, memory loss. You find that there is dementia that begins to set into play. If it affects your heart, you start having heart conditions due to that. So you find that as it's affecting different organs, it's beginning to cause symptoms in those particular organs. So, how does one get to know that they actually have syphilis? Number one, symptoms. Remember what I said. Sometimes, and most times, people would not know that they're actually suffering from symptoms because they will not have any symptoms whatsoever. So, when it comes to syphilis, and if an individual develops symptoms, they might be in the early phase where they have the sore or the chancre, or they might be in the secondary phase where they develop that rash, or they might be in the tertiary phase where they develop those brain signs, bone signs, or heart signs when it comes to syphilis. How else do you get to measure it? Number one, through blood test. So there are different forms of blood tests that can be done to help diagnose that you have syphilis. Something that is very important when it comes to blood test is that your blood test can remain positive for syphilis for a lifetime in some. So these are individuals who've been infected despite having treated or having gone treatment for this particular infection. You find that when they undergo a screening test, which is done at almost every healthcare or facility, you find that the result always comes out positive. However, there's another blood test that can be done that actually shows the levels of infection within your system, and that shows whether or not an individual has responded very well to the treatment. And this includes tests such as RPR or VDRL in particular. And you find that with these particular tests, the VRDL, um, you can know whether or not the treatment has actually worked. So, very important is that the rapid tests, the ones that we get to do, can remain positive for even a lifetime. And this is despite somebody having been treated for syphilis. So, other invasive tests, such as a lumbar puncture, can be done in a situation where an individual has got an infection, more especially tertiary syphilis, that has gone to the brain. So, how do you manage syphilis? The goodness about the management of syphilis is that it is a bacteria infection. And because it is a bacteria infection, antibiotics are very useful when it comes to syphilis. So, usually with primary and secondary syphilis, a single jab of benzathine penicillin is more than enough to take care of the treponema pallidum, which is the bacteria that causes syphilis. Lifestyle modification is something that is also very important. Remember that the risk factors of one contracting syphilis are also related to the lifestyle that somebody leads, and that puts them at risk of getting the bacterial infection. What are the complications of syphilis? So you find that when it comes to complications of untreated syphilis increases the risk of one acquiring HIV. Untreated syphilis also increases the risk of one developing other sexually transmitted diseases, such as gonorrhea, chlamydia, and herpes. And as well, when it migrates from being primary, secondary, and latent phase syphilis, where it goes into that tertiary level, you find that if syphilis is untreated, it will affect various organs of the body. It can cause injuries to the eyes, it can cause hearing problems, it can cause injuries to the brain, and that is what you call neurosyphilis, and it can affect just about any organ within your body. In terms of complications of untreated syphilis in pregnancy, remember, this is a bacterial infection that affects one's blood. And as long as it is living within the blood, it means it can pass from the mother to the baby through the placenta itself. And even as it passes through the placenta, it can cause a sudden death of the baby within the womb, which is called a stillbirth. It can also cause early complications to the baby, with the baby dying within the first 28 days of life due to this overwhelming infection. It can lead to premature delivery. Why? By affecting the functionality of the placenta itself and leading to prematurity with the baby. It can lead to low birth weight babies. Why? Because the function of the placenta has been severely inhibited, and therefore nutrients are not traveling very well from mother to baby, and therefore can lead to babies being born with very low birth weight. And it can lead to complications, lifelong complications in the babies that are born with syphilis. So, how do you prevent syphilis? Number one is by understanding the primary method in which syphilis is spread. And remember, this is commonly spread through sex. So, safe sex practices plays a critical role in one managing syphilis or preventing syphilis from happening. So safe sex practice, in particular, the use of barrier methods, condoms. I always say condoms are the only contraception that is out there that can prevent individuals from contracting sexually transmitted diseases. And then also use of personal protective equipment for healthcare workers who deal with a lot of fluids and blood when they're dealing with their patient, frequent testing and early treatment. So with frequent testing, we're talking about people that are at high risk of having infections with syphilis, and this usually requires that at least you test once a year. And once you do test and you find that you're positive, it is important that you also inform your partner that you're positive and both of you get the treatment. So, syphilis remains a very common yet fully preventable sexually transmitted infection. When left untreated, it can lead to serious long term complications. Importantly, it can also be transmitted from a pregnant woman to her baby during pregnancy, making early detection and treatment essential in this particular population. This is the end of my short presentation on behalf of Home Care Clinic. The whole idea was just to shed some light on syphilis itself, which is an extremely common sexually transmitted disease. And what even complicates it more is that it can be passed on from the mother to the baby, putting a baby at very high risk of this particular infection. I'll now open it up to the team on the chat to see whether there are any questions on syphilis, anything that you'd like to ask. Please feel free to raise your hand in the chat box or to simply type out your question. Are there any questions? Okay.
Good evening.
Yes, good evening, Sister Takozwa.
Yeah, thank you so much for the powerful presentation. I was just concerned with the RPR, which can be like positive for lifetime, because there are some people, like maybe you might not understand that they were given the benzathine and you continue treating them. I don't know, is there a way we can try and discover that, okay, this time the syphilis is gone, we can't treat, any other test that can be done?
Thank you for that very important question. And you're absolutely right in the sense that You find that for some individuals, they did get treated, but because of the screening tests that we get to have, which is these rapid tests that we get to do within our facilities, and even as we're doing those particular tests, it's always coming out positive. And it can be quite concerning, more especially with couples in that particular sense. So, in terms of what can be done, there's the rapid reagent test. There's also the VDRL, Venereal Disease Research Laboratory Test. And these particular testing methods help to determine what we call syphilis titers within the system. So when someone initially just has an infection, you find that the titers are very high. Some can reach up to 32 to 1, some can reach 64 to 1. But with treatment, what you expect, more especially over a 6 month period, with primary and secondary syphilis, is that there should be a drop that is happening with these particular titers. And then with secondary syphilis, with secondary and in tertiary syphilis in particular, you find that if you're treating them, the titers drop over a 1 year. So the idea is to get the titers to as low as 1 to 1, which means this person has been treated and they're not infectious, or somehow as low as 1 to 4. So those are the more definitive tests that one can do. So if an individual presents to you, or if one has been treated for syphilis and they're still getting that positive test, it's important that they go and do the RPR and the VDRL test in particular. And this is the one that's going to show them the actual levels of the titers. And it will help them understand whether they've had a fresh infection or it's the old infection that they have that has already cleared up in their system. So I hope that answers your question. And unfortunately for that particular test, it's not a rapid test that facilities can do, but it's one that has to be run in the laboratory.
Thank you. Thank you very much, Doc. Thank you so much.
You're most welcome. Mrs. Simonza, you can go ahead and mute yourself.
All right. Thank you. Good evening, everyone.
Good evening.
Thank you, Doc, for that presentation. I just wanted to get more clarity on the treatment of the latent and the tertiary syphilis, because you only mentioned about the primary and secondary being treated with one single dose of benzathine penicillin. Thank you.
All right. Thank you very much for that question. So when it comes to the latent phase of syphilis in particular and the tertiary phase of syphilis and the CNS manifestation of syphilis, that is where treatment now comes in with those shots that we're talking about, 1 weekly times 3. So that's where they actually do come into play. So with those stages, you need to give your once a week times 3 cycles in terms of your treatment. So with your primary and your secondary, that's where just a single dose is sufficient. And I hope that answers the question with John Palicha. And I think the challenge that's there most of the time with healthcare workers or with what's there in the system is that most individuals are unable to differentiate whether this is a person that is having a primary or secondary form of syphilis. And you find that we're still sticking with the old regimen of just having to give the 3 injections, 1 a week for these particular patients. And it does form quite a huge clinical dilemma because of the testing methods that we have and the fact that it is asymptomatic, and the fact that most individuals will not even remember if they actually did develop the chancre or the sore, or if they went through a period where they developed this maculopapular rash in particular. Do we have
Thank you very much, Doc.
You're most welcome. Do we have any questions? I've seen there's a question in the chat from Mapenzi Mlenga saying, are there any plans for the syphilis vaccines? I think with modern research, and just the advancement of science itself. That is something that is definitely being looked at. Unfortunately, currently, there are no vaccines that are available on the market against syphilis itself, despite it being a very prevalent sexually transmitted disease and that carries very high complications, more especially in the pregnant population, if it is not tested and treated for. And the earlier it is tested and treated for, the better the outcome in terms of the baby and the health of the baby. So the first trimester is absolutely key, and it is important to test within the first 3 months of pregnancy and treat within that first 3 months of pregnancy. And remember, just like any sexually transmitted disease, it is not enough to just simply treat one individual, but it is important for you to treat the partner as well, because there are episodes of reinfection that can actually happen. Are there any other questions concerning this particular topic?
Good evening, Doc.
Good evening.
Pastor Piri on the line. I wanted to ask a question.
Yes, please, Pastor Piri.
In syphilis, there's tertiary and primary. Now, I wanted to ask, is it late diagnosis or poor management of the disease that leads to the attack of the spine?
Thank you very much for that question. So I would say it can be both. So to start with, you find that the neurological symptoms in particular, where it attacks the spine, it attacks the brain, number one, they're also dependent on one's immune competency. So that is something that is very important. Because remember, with the primary syphilis, your body's own immune system can actually take care of it. And it can only take care of it if your body is healthy enough to fight it. Even when it comes to secondary syphilis, you find that if your body is able to fight that particular stage, then it can take care of the symptoms that come into play. But please note, I did not even mention this part. Even in secondary syphilis, depending on one's immune competency, there can also be these symptoms where it affects the brain and it affects the spine. So, number one, if one's immune system is not strong enough, that can be a reason why. Number two, if the disease process is not treated, you find that it will progress into that particular stage. And if the disease is not treated, you find that your body will go through these stages where it fights it, clears it, but still the primary bacteria is still going to be there within your system. And that's when you're going to go into that graduated phase, which is a tertiary syphilis, where it begins to affect the brain. It starts causing this memory loss. It starts causing this headache, these meningitis type of effects. It starts affecting various important organs within your body because the bacteria has been in your system for such a long time.
Thank you, Doc.
Thank you very much, Pastor Perry. Are there any other questions that we can help clear up concerning syphilis? So if there are no questions, this was just a short webinar. In summary, number one, syphilis is a very common sexually transmitted disease, and we find that the levels of syphilis are on the rise. I think we've seen statistics in Northwestern Province, Solwezi, Kalumbila, where we've seen there are very high levels of syphilis. It is primarily sexually transmitted. And because it is sexually transmitted, you find that the vulnerable population, the pregnant population, can get infected with it. And once they get infected with it, there's an ability for it to be passed on to the baby within the womb or at the time of delivery. This is what you call vertical transmission. However, syphilis is highly preventable and highly curable, with the primary, secondary phases of syphilis being treated with just a single dose injection of benzathine penicillin whilst you find that the latent and the tertiary phase will require more than one injection, usually 3 cycles of it. And if you find that there is neurological or there is syphilis that is affecting a newborn, you find that the treatment is more prolonged for about 14 days. And when it comes to symptoms, unfortunately, for most cases, there are no symptoms. But something worth noting that in the primary phase, the chancre or sore is the primary sort of symptom that most people will get. In the secondary, there's a rash, which is non-itchy, that might develop in the palms of the hand, soles of the feet, even in the genital area. And in these stages, you find that individuals are extremely infectious. How do we prevent it? For the pregnant women, early testing within the first trimester is very important. Early testing and treatment. You find that for the general population, it is important to test for syphilis, to be treated, and to ask your partner to be treated as well, partner or partners, because we know that the risk of syphilis is higher with people with multiple partners, people that indulge in substance abuse. So you find that it is very important that one gets tested and one gets treated. So I'd just like to thank all of you that took the time to log in. This was a recorded session, so we'll be able to share the link as a clinic where you can catch this, and do share it with individuals, and hopefully this helps save a life. Thank you very much, and wishing you all a very lovely week.
Thank you very much.
Thank you.
Thank you very much, Doc.